pulseless. And you must know how to determine if a patient is pulseless. Anybody knows? Anybody here? Right. That's your radial pulse, you have your brachial pulse up here. Also your ulnar. You have a few others, but that's the most popular ones. And you take your carotid, which is there. Okay? To begin CPR, first take BSI precautions. Okay? Which means you must have your gloves on to avoid you don't get any blood spill and get infected. Right? You must make sure also that the patient is lying supine, which is this position, head up. You must be lying on your back. You must open the patient's airway using the head tilt, the chin lift, which will be demonstrated. In order to administer effective breaths when doing CPR, the airway must be open. So this is the method used to open a patient's airway. If the patient is breathless but has a pulse, deliver 2 rescue breaths. This is a piece of equipment that we use to deliver breaths. Then you check the patient's pulse again. If the patient has no pulse, the condition is deteriorating, then you start compressions. You must place the heel of your hand on the sternum, which they will show you. The sternum is right here. The heel of your hand, right. Interlace your fingers with your hand. Now your hands must be fully stretched. Position your shoulders. And you begin compressions. Your compressions must not go too deep, or else you're going to fracture your patient's rib. Okay? Yeah? They must be at least 2 inches deep to be effective. You must give at least 30 chest compressions at the rate of 30 at the rate of about 100 every minute. After every 30, you give 2 rescue breaths. It is very tiring. 2 breaths. You must do 4 of these in 1 cycle, okay? After 1 cycle, then you check for pulse and breathing. There is a method of checking for breathing. It's called, we call it look, listen, and feel, which you'll demonstrate.
You look and listen and you feel. When you look for any rising chest. Okay? So after.
When you look, you have to look for the rising of the patient's chest. That would mean that the patient is breathing. You listen for the breaths, and you feel like he's doing. If the patient is breathing, you would feel it on the face. Right. give CPR until the ambulance arrives, until EMT or EMS arrives. Okay. If